Well, welcome to this webinar. Thanks for joining us at 2 p.m. Eastern Time. I don't think we've ever run a webinar in the afternoon, but that's just reflective of who we are and what we're doing. I'm Dr. Lee Sheldon, and we're going to talk a little bit today about some of the things that we're all going through. We don't think that we know any more than you do, and frankly, your questions and answers may be very beneficial to us. So we hope you'll ask those questions. This is a time where some of us will feel that we're out of control, that we don't know exactly what's happening, what we should do. And just a little essay that I wrote just earlier today, control the things you can control. The things where you have some opportunities, where you know something needs to be done, look at that. Just don't look at the whole thing. The whole thing, it can be pretty frightening because none of us know what's really going on out there nor what's going to happen. But the little things you can control, that you can control from inside a project. It may be cooking a meal. It may be cleaning my office. You ought to see what my office looks like. You only see the good part of it. Doing something makes you feel better, and it'll make others feel better around you. The other thing that we all have to understand is that we're in control of our families. We're in control of our practices, and the people that we know, that we work with every day, are looking to you for leadership. So they're looking for that rock solid foundation. So we might have some thoughts when our heads hit the pillow at night, but when we're present in front of those who depend upon us, we've got to be there. We've got to be solid in our decision making. We have a great panel with us tonight, or today together. With us, we have Dr. David Scharf, who's a periodontist from Babylon, New York. Dr. Michael Sonick, who's a periodontist from where in Connecticut? Fairfield. You're Fairfield, yeah.
That's right.
And my office manager, Danyel Salmela, who's been working with us tirelessly for many, many years. And she can give some input with regard to how she's handling staff and some things that she's been doing with staff that have been just tremendous. You'll have the opportunity of asking questions. There is a Q&A bar someplace, probably at the bottom of your screen. Just type in the questions that you have, and when the time is appropriate, I'll be going through the questions, so I'll act as moderator today. I'll ask the questions of the group, and we expect there will be quite a few questions, some of which we can answer and some of which we may not be able to. And hopefully we'll all get something really positive out of this when we get done. So let me ask the first question, since Mike, you're right in front of me right now. You're center screen for me, so you're center screen for the entire group. Tell me, what's the main focus of your practice right now?
Yes, well, I mean, I look at this as we talked about, any sort of crisis. I always look at it as an opportunity. These are sort of our greatest teachers. And so this is an opportunity because the team is going to be looking at us because we're the leaders of our team. How we're going to manage this, how we're going to manage our patients, et cetera. We initially closed our practice about 3 days ago. And we decided we get a little bit ahead of it, but it didn't take long for everybody else to catch up, 24 to 48 hours, because this is moving so rapidly. So we're closed now for a minimum 3 weeks. I don't anticipate we'll probably open until, who knows, maybe May, maybe June, I don't know. We're looking at it as an opportunity to do some training for our staff, do some writing, get some more publications out, to educate, our community. We have a physical plant. We're cleaning the office, waterproof the basement, as we said. We're renovating our laboratory. We have about 20 employees. 2 or 3 of them are relatively new. We're utilizing this as a training program. So there's going to be a large backup of patients. And so when this whole crisis is over, we're going to be extremely busy, even busier than we are. We're pretty busy to begin with. We want to come out of this, ready to go. And I want to come out of here with a strong team. And what do we do with the team? Well, right now with our team, we haven't laid anybody off. We are paying them. And if they're not working, we're going to be paying them 2/3 of their normal salary. So we pretty much are allowing everyone to work about half time, even though we're not seeing patients, just emergencies. Our office is open, Monday through Friday for emergencies, seeing maybe 1 or 2 a day. I think that's going to increase with time. because very few offices are open. And so we need the skeleton team here. We have 2 assistants, 2 front desk people that are here. I also have an IT person that's helping us out. My partner, Raymond, and I have been here in the office pretty much most of the days, just catching up on paperwork and doing things like that, motivating the team. What we've developed is we've developed a training program for the team. So not everybody knows everything. So I'm going to cross-train everybody during this period of time so that people know, everyone knows how to take a cone beam CT scan, everyone knows how to photographs, everyone knows how to do laboratory work, everyone knows how to file everything. And then we're just doing a full cleaning of the office, which is a lot to do. So when we're all done with this in the next 1 or 2 months, our office is going to be pristine, the staff is going to be pulled together, and I want to have a very strong team. We haven't yet furloughed anybody, but there is something was just passed in Connecticut that they give partial disability. So we're encouraging people to apply for partial disability, but we're going to try to support them during this period.
So we're talking about partial disability. You're talking about partial reimbursement as an unemployment, or is this something else?
As unemployment, they can apply for partial disability. So if there's a decrease in their pay by, let's say, 30 or 40%, they can apply. Problem is, I think there's already 70,000 people in line for that, and the computers are crashing. So the whole country is going to be applying for disability in some form or another. I think it's going to put a lot of stress on the system. And I don't know what Trump's law has done for us, for those of us who have employees under 50 people.
Yeah, apparently the last thing I read is that's going to go to the Labor Department. That decision has not been made yet, and the American Dental Association is fighting very hard to go to the Department of Labor so that those of us who are employing under 50 would not be covered by the same rules. Yeah. David, what about you?
Well, I have a smaller team than Michael. We have 11 employees, and I've furloughed most of them. We just had a payday on Monday. A pay period ended, and I, explained to the team, and I think they really understood beforehand that I want to have something to come back to. One concern I have, Michael, in terms of what you did. So I'm keeping one person at the front desk to handle phone calls. We have another front desk person who can sort of be in another office in our office so she can work. And I'm having one of our clinical team come in each day to do a task, for as long as those tasks go on. And I have a list of gazillion things that they can do and that I can do. And my guess is we'll be through all of those in about a week. One concern I have is, do we have any liability or exposure? I think it's great to just say, let's just pay you for this time. And I can tell you that that's what Heartland is doing. Heartland's giving everybody 2 weeks off with pay, which is, I think, a really generous thing. But I wonder if you have 2 assistants in the same office and you can't separate them and one of them gets sick, now the other one gets sick, are they going to feel like, hey, you didn't separate me, or I couldn't work from home? One of our team members just came back from Puerto Rico. So as frightening as the virus is, she couldn't resist that low fare to get away for a weekend. And now the other ladies don't want to be near her because they think maybe she's going to be infected. So, that's a concern of mine. One thing I tried to do this week, and Monday was our last day as well, is I really went through QuickBooks and I went through our credit card statements. And other than the Institute for Dental Specialists, I cut out all the fat. So
I promise this will be non-commercial.
But but it's amazing how many things you get at, it's $50 a month, $100 a month, it's only $200 a month. We all get 3 or 4 newsletters. We all have, all these things. I own my building and my tenant also was closing. So I cut out my dumpster. I don't need a dumpster. Whatever waste the front desk generates. So, I think during this time, we really have to be careful and look at how much cash we have. We have to really cut out the expenses that we can cut out, because there are things we can't. The property tax isn't going away. Insurance isn't going away. Some of these things aren't going to go away. And I remember 2008, as I'm sure you do, a lot of dental practices just went bankrupt. They closed their doors. And so that's what I've done with the staff. It doesn't mean that in 2 weeks I won't feel different and say, hey, you know what, ladies, I'm going to give you each your week for the pay, your pay for the week or a bonus. But I'm nervous about sort of overextending myself.
In going along with the idea of cutting expenses, one of the biggest expenses that we have is marketing. We are a direct-to-patient practice, and the rule always is market into your strong periods. At least that's always been my rule. And so with regard to marketing, that was one of the big expenses that has to go right now. So if we have a Google Google advertising campaign, that's gone. We send out magazines. We're delaying that. Everything that we're keeping the website up, of course, and we've got Ace Chat, and the chat line is good because they can act as our representatives when we're not there, and Beth is fantastic. So we're keeping that going. But the other marketing expenses, no. As Michael said, and I'm sure David's the same way, we are going to have a backlog of patients when we're ready to get back, and we're all going to have to take care of those patients first.
Yeah, you know, that's a good point, Lee. And sometimes people say, well, it's slow. People are home. They'll have time to look at your stuff. But, you know, I have friends who are booked a month in advance in other parts of the country, can't get a patient in for a month. And they say to me, well, what kind of marketing should I do? Because my practice is all patient-driven as well. And I'm like, if you're booked a month in advance, why would you spend a penny on marketing so you can be booked 2 months in advance?
Right.
So right now, you know, we're booked a month out. When new patients call, we're putting them a month out. So I agree with you. That's an expenditure not to make right now.
Absolutely. Yeah.
It's almost like
Danielle,
having you know.
Danielle, what are we doing?
Well, of course, we want to take care of our staff, and my biggest concern, of course, is our staff, because some of them are paycheck to paycheck and some of them are not. So we do have a large staff. We have 19 people in our practice, and they all have different personal lives of what they need economically, financially. So the first thing that I did was I interviewed all of our staff to find out what they need, because they are all different. So I asked them, how much time can you take off? And after you take off that time, use some of your vacation time, then what do you need minimally to pay your bills? You know, they need to economize at home as well. They need to cut back on some stuff as well. And then, so what do you need? And after I did that through 19 people, I was able to get 5 people that need to work. And those 5 people said they need 25 hours. And so I was able to dramatically reduce the amount of our responsibility financially we had to pay these people. And that way we could still keep going. I saw something run across the room.
That's my daughter. Yeah.
But anyways, I think that was something that we have to do, because they're not all the same. They don't all need a full paycheck. And they were nice enough to say, listen, we know some people need that money. I'm okay. My husband works. I'm okay. We had a big savings. I'm okay. I have 136 hours of vacation. I'm okay. So, just talking with them individually so that they knew that, okay, I really care about you individually. So let's just have this one-on-one conversation and let me know what you need. So a lot of them gave me, a handful gave me 1 week, a handful gave me 2 weeks, and a handful gave me 3 weeks. So we're kind of working with that right now. And the hopes is we'll get some relief from the president, the check that they're talking about sending everybody. That will help them there. And then hopefully we will have other reliefs coming in as well. We don't know what that is, but we can work with a handful of staff to do the stuff, like you said, Dr. Scharf, to take care of some stuff. Dr. Sonick, same thing. While we have this time, you're right. We have to catch up on our OSHA, our HIPAA, our emergency protocols. We have organizing. We have so much of Dentrix paperless stuff that we can integrate that we have never had time to do. Medical history is online, consents that are paperless to sign with the e-sign. So much that we can do that we're always saying, we don't have time for this. We don't have time for this. We got to go, go, go. And I think we can use those 5 staff to get us to that point within 3 weeks.
I think one thing that we did come up with staff that seems to be unique, and we did check this out, is that for those who do need to get paid after things happen after the next few weeks, that we have arranged a loan so that we are giving staffs loans and having them sign a promissory note so that when they come back, when they work those additional hours, which we know they'll have to work in order to be able to make up for what we're not doing over this period of time, that for any overtime they work or any hours they work over and above, what they would ordinarily work, that will go back towards paying the loan. And it seems to pass muster with, at least with our accountant. I mean, might want to check it out with your accountant yourself. But at least that gives us the opportunity of giving something to them now, and later on they make up for the work later on, and they'll pay it back. So if we give them a $10 loan and they're coming back and they're working an extra hour at $15, that $15 would then go to pay off the loan. And we hope and anticipate that that will work well for us. That would assume or presume that staff member is willing to work more than he or she ordinarily would. In other words,
Right.
staff member works 40 hours, we hope and expect that patient will work 48 hours. And if we decide to open on Saturday, which we don't do in Florida, you guys do up north, but we don't down here, that they'll be willing to work at that time. And that is part of the ongoing discussion.
I think we have a very fluid situation here. And I mean, this is changing day by day. We don't know if the government's paying, if they're not paying. We don't know how long the virus is going to be here. If we've gotten ahead of it because of some of the precautions we've taken in the States, are we going to turn into another Italy, or are we going to be more like Korea? And the impact it's going to have on patients coming back, because they may look at half of their income, gone because of the stock market. So for us, initially I've been very generous with the staff, and I maintain that same generosity if this goes on for 6 weeks, 8 weeks, et cetera. And one of my role models is Danny Meyer, who owns Shake Shack restaurant and all the great restaurants in New York. He's a leader in hospitality in the world. He's got 2,000 employees. He's worth close to $800 million just in hospitality. And we pattern our office and our team after Danny Meyer's. We take our team to a Danny Meyer's restaurant in New York every summer. He is the hospitality chief. And last week, before anybody was shuttering their businesses, he closed all of his restaurants. And he guaranteed that he pay all of his salary for his staff. He was going to take care of them in the hospitality business. Well, today, he laid off 2,000 employees, and he gave about a 4-minute tearful speech to them all. He says he never thought that he'd ever have to do that. So within 1 week, my idol in hospitality, who I really was respecting for supporting everybody, said I can't do it because there's no income coming. Mm-hmm. Our practices pretty much will have no income coming in here for at least a month, maybe 2 months. So how are we going to handle that? I don't know yet. So I'm doing everything I can to support them now. And we sent them a letter saying we're going to support you for the next 2 weeks. We're going to reevaluate that in 2 weeks. And today we're sending out a letter saying if you can apply for partial disability, do that. So we may get some help from the government. They'll be able to help us as well. And we'll figure it out. In terms of marketing, we don't spend a lot of money on marketing, but we do a tremendous amount of internal marketing on the website, books we write, and things like that. So my partner Ray and I, we're going to be doing a lot of videos over the next few weeks. We're going to be doing a lot of, posting those videos on our website. We're going to get a large volume of material so we can get ready to, roll it out. We have a few books that we've written in-house that we give to referrals, et cetera. We're going to print a bunch of those. We're going to send those out with little letters, et cetera. So we're going to become like an internal marketing machine. So these next 4 weeks, they're going to be very busy for us. I've been in here today, and I jokingly said before, I've been in the office for 6 hours, and I've done a total of 20 minutes worth of work. That's what it took me all day. The post-op that takes 5 minutes, ended up talking for 45 about nothing. And that's been what my day has been like today. And I think it's not going to be hard for us to fill the time and have our staff fill that time, sort of bringing us together. What I don't want to do is I don't want to emerge from here with a fractured, fragmented, practice where I got to rebuild all of that because we wasted a month and a half of not nurturing that staff. So however we can do that and still maintain our financial viability, I think it's the best for everybody.
It is.
I want them to have a practice to come back to.
So what about the younger practitioner? Anybody have any thoughts? We've all been in practice for years. We're considered somewhat stable or very stable, but there are a lot of people watching out here who are saying, all right, listen, I've been in practice for 10 years. I've been in practice for 5 years.
Yeah.
What do I do? Any thoughts?
Well, I think they have to I think it'd be very important that they get a line of credit. And if they don't have one in place, to get one in place so they can use that. You do the things that David was talking about, get really lean, get really mean, pull things back, tighten the waistband, and do the best that they can so that they're prepared when everything comes back. And during this period of time, be real positive, be real upbeat, be the leader, be the beacon of hope and light. Because out there, a lot of people are complaining. They're really scared. They're running with fear. A few weeks ago, I said the virus I don't have to worry about is the coronavirus. It's the virus of fear. There's a tremendous amount of fear in the economy. The stock market is tanking. Our economy is good. It was great a month ago. Why is it tanking? It's because of fear.
Yeah.
A lot of people, I'm looking at this as an opportunity. I'm laughing during this period of time. Not because I'm happy that this is going on, but I'm looking at this like this is always joy. My house flooded. I've had 2 floods in the last 7 or 8 years. I live right by the beach. 4 feet of water in my house. And I was like, all right, this is interesting. What's my opportunity here? So we ended up renovating the house, et cetera. And I lived in the 3rd floor of my office for a month. And because we shut down in our town for 2 weeks, we did no business. 6 years ago when Hurricane Sandy came through. And that was an opportunity to rebuild and become part of the community, et cetera. So I'd like to become a more effective, integral part of the community during this period of time and put the message out there of hope that we'll get through this, because everybody in the country is going through this at the same time.
Yeah, I
None
agree
of us
too.
are isolated.
Right. I have to echo what Mike said. I think just you have to put aside what you said as well, Lee. You have to put aside how you feel about your practice and your concerns. And when you talk to the team, just let them know, look, we got through 9/11. I remember, we all remember 9/11. It seemed like the world was ending.
Yep.
We were affected by Sandy as well, Mike. It seemed like, I'm on the South Shore of Long Island, my practice. Everybody flooded, and we got through that just fine. So and we'll get through this just fine. It's a little more undetermined what's going to be, but you have to give that message to the team because they want to know that they're going to have jobs to come back to. You have to wonder if you furlough them, if they're thinking, all right, well, you know what? Here's this government job I can take for $20 an hour. Maybe I'm going to take that because who knows if they're going to be back. So we've been really clear with that message. And I'm starting to think of how can I interact with the staff on some sort of weekly basis. We're all on like a chat group together in the office when we send messages back and forth. So I'm going to think of ways we could just update and stay in touch. Reach out to each of them individually, see how they're doing, what are they up to, and maintain that bond as opposed to have no contact for maybe 6 weeks and say, okay, come back in. You're separated at that point.
Right. Yeah. You can do meetings like this, Zoom meetings online.
Mm-hmm.
Just get together with them. We do have a few questions, Dr. Sheldon, if you want to answer some of the questions that are coming around as we're talking.
Yeah, absolutely. I will. Okay. We're being asked to do only emergency care now to prevent disease transmission. When we advise it is okay to return to normal operations, how will we prevent disease then when we supposedly can't do it now and there's no effective vaccine available and likely not for a year? If a staff person or patient is diagnosed, then do we quarantine the entire office for 2 weeks? I'll start there. Let me start the answer to that question because I think it does throw, that's a question that's open for discussion because when you don't know, you don't know. Right now, we are isolating our staff so that even if we have staff here in training, we are isolating them from each other. They can't be in the same room together. Well, occasionally they will, but essentially they're doing their own work in their own room, which Danielle talked about, I think.
Right.
The other thing is that there will be a new definition in some ways of what cleanliness and what hygiene is in the office. And so where we weren't using face shields before, we'll use face shields now. Where we weren't always covering up entirely, we will cover up now. In terms of preventing disease without a vaccine, I don't think the vaccine, personally, based on what I've read, the vaccine, you're right, it's not going to be here for a year or a year and a half. But what appears to be on the horizon, particularly when they're talking about chloroquinone, hydroxychloroquinone, Plaquenil possibly being effective, is that there's going to be antiviral therapies that will be available to us earlier. And so that doesn't prevent disease by any means. But it may at least lessen the severity of the disease, and that's the hope. Personally, having gone through a number of vaccines or vaccine issues over my life, vaccines are not always 100% positive. I remember when I was in the Army and I was forced to get whatever the vaccine was for the swine flu at that time. There were a number of people who died of that vaccine because it was given too early. So there are things that we need to do. And if you look at some of the nutrition literature and some things that people read about taking vitamins, vitamin D, for example, has been shown to reduce the severity and incidence of the flu. So we've got to start looking at some of the things that we can do for ourselves. Maybe we're getting away with some things nutritionally that we can't get away with now. Anybody else want to tackle the question?
Well, from what I've heard, and I'm curious to know, the whole purpose of being isolated now is to lower the peak. That they still expect a large number of people to get infected, but the goal is to not overwhelm the health system, so everyone that gets sick can be the seriously ill people, that there's enough resources to care for them. So at some point, when 70 or 80% of the population has had it, there'll be a certain amount of herd immunity, and it won't be as infectious. But I agree with you, Lee. I think that how we dress every day for work is going to be very different. It always amazed me that we'd wear face shields, gloves, and that, but you could have as much aerosol as you want, spray in your hair, and not mandate to wear a cap. So I think how we dress is going to change. But I think there's going to be a new normal. Like after, AIDS came out, we started to wear gloves, and it seemed strange at first, and there was a new normal. I think we're going to have a new normal now, just with respect to the aerosols we deal with.
Yeah. The final question on that, which Jeff asks, is if a staff member or if a staff person or a patient is diagnosed, then do we quarantine the entire office for 2 weeks? And that's the norm right now. If you're exposed to the virus, or if you have the virus, I'm not even sure if you're exposed to the virus, people I don't think are quarantining themselves for that long a period of time. But what's the rule going to be? And the answer is we don't know. We don't know what's going to be appropriate. Initially when we heard about this disease, we thought it could only be contagious when a person actually had active symptoms. Now we're finding out that a person could be a carrier, not have symptoms. A person can get the disease, but be a carrier 2 days before the symptoms express themselves. There's so many unknowns here that we're not certain. We're also not certain, even though we're all taking these precautions and for the most part are shutting our practices down. We don't know how bad this virus is. So we are hearing different things from the people who are in charge of this, but even those statistics change, and it's going to be very difficult really for us to measure all of the statistics, because unless we test everybody, how do we know what the true incidence of the virus is? Somebody said to me earlier that we'll really know it by the number of people who die, and of course that's going to be a retrospective study. We really won't know. Mm-hmm. That's why we don't dwell on that part of it too much. We dwell on what we can do in order to be able to make our individual lives better, and frankly, how to help each other in order to be able to get through this. And that's what we can do. Any other comments before we go on to the next question? Good. Okay. With adequate screening protocols for patients entering the office, we should be able to continue seeing urgent cases during this time. Do you guys agree? What screening protocols do you have in place?
Yeah, we have to see. I think we do have to treat emergency patients who are in pain. I saw 2 emergencies today. Neither of them were emergencies. Severe emergencies when they came in. So it's just an exam of the systems. But I think that we have a responsibility to treat them. I mean, doctors in a hospital do as well. We take everybody's temperature as soon as they walk in the door. We record it. We ask them if they've traveled. We ask them if they have any symptoms. We ask them if they're coughing. And then we have everybody rinse with peroxyl for 1 minute before we treat them.
Michael, you are going in and out. Maybe if you got closer to wherever your microphone is, that'll help.
Okay.
Great. Thank you.
We have them rinse with peroxyl for 1 minute as well, and we take everybody's temperature, including the staff. So, when I walked in today, the first thing they did was they took my temperature. We had a working crew here. They put up a new sign. And we took their temperature before they put it up. We had an electrician drop off a dehumidifier. We took his temperature before he walked in. We screen anybody that walks into our office.
Good idea.
We take the normal precautions. I think common sense is a big deal. This quarantine thing, I mean, physicians that work in the hospital with patients, do they quarantine themselves? They go right back to the hospital. there are so many vectors in this world right now walking around with this virus that we can't be immune to every one of them. I think that we're as a country, we're probably taking pretty good precautions right now, much greater extent than I ever thought about a week ago.
Yeah.
Right.
And of course, everybody's looking at Italy and saying, we don't want to become Italy.
Right.
But my understanding is that there was a great deal of travel between China and Italy. And so Italy may, in fact, be the outlier and not the norm, which, of course, we all hope for, not for them, but for us.
Right. It seems the death rate in Korea is much lower. I believe it was under 1%. Of course, we don't know what it is in China. We're not really sure of the data. But in Italy, the death rate seems to be 5 to 6%. And we don't know what it's going to be like in the United States. It's sort of slanted right now because of a lot of the old age, where people are a little bit more prone to the disease. Doesn't seem to be affecting younger people as much.
Yeah.
Severe.
Yeah, so far. Yeah. As far as the screening protocols that we have, I went to CVS and bought them out of forehead thermometers. And so we are using those. We do have them in the office. I went to every Home Depot and in the county to try to find enough face masks, because we don't, not face masks, the face masks, I'm talking about the shields, in order to have something that that we could use, because we didn't have the disposable ones. Our staff wasn't using those. They will be from now on, I would imagine. I think that will be the rule, that in fact the entire face will be covered and everything else will be covered too. And we'll pay a lot more attention to that. There are some people that are not allowing patients in their reception room, either if they're not ready to be seen and be brought into an operatory right away. If we have a number of emergencies at one time, and so far we haven't faced that, but we will tomorrow, that either they're brought into the operatory or they wait in their car until we get them, which makes a lot of sense. I mean, isolation and social separation. What is it? Social? What are they calling it? Social distancing. It's something that we all need to do. Danielle, anything else that we're doing that I missed?
The big thing is the questionnaire that you had made for the patients and taking their temperatures, which, I mean, we really don't know what the best screening items are, but we just have to do the best that we can, keeping everybody distance where they're not in the same area together, just for precautions that maybe they're not symptomatic, and then keeping as the least amount of people in there as we can. And then, of course, cleaning those rooms before another employee comes in, and we'll do that for as long as we can. I did have some questions regarding that towards the bottom. It said the new data for the Centers of Disease Control and Prevention shows that among the roughly 12% of these cases in the U.S. known to be hospitalizations, about 1 in 5 among the people ages 20 to 44, or among 20 to 44. The CDC report released Wednesday tracked the health outcomes from February 12th to March 16th for the 2,449 cases in the U.S. whose ages were unknown. So I don't know what they also said. We are talking about screening measures. One person said taking a temp is not screening. We just don't know what we're just doing all we can to do it. Have any dentists contracted the virus from an office setting that we know of, either in this country or abroad?
Anybody know?
How would you know? I mean, how would you know where you get it from? We're all exposed
True.
all day long.
Yeah. But has any dentist gotten it? I haven't heard of any dentist that's gotten it yet. We probably get that information, I would imagine. But
If they are, they're probably keeping it quiet. I don't know if I was a dentist and I got it, I want to broadcast that.
Yeah, you're probably right.
To anybody. As far as the screening, just my 2 cents, so we're only supposed to treat emergencies. So a patient comes in with 102 temperature and their face is out to here from an abscessed tooth. We're there to treat them, right?
That's right.
So,
we are.
Like Michael said, he saw 2 emergencies today and neither one was an emergency. So, I had a patient call up the other day. He had some crowns placed a little too deep subgingivally. He's got some gingivitis. It's been that way for a month. Could he come in so I could look? We said, no, it's not an emergency. So, I'll play devil's advocate that that before we were treating emergencies, maybe taking someone's temp made sense. But at this point, because they're infectious, whether they have a temp or not, they're in a prodrome, you have to treat everybody with universal precautions as if they are, and really truly try to do as little as possible on those patients to get them out of the operatory. Yeah, I think there's a creep, there's like mission creep, you have to take out this tooth, but it's a good immediate implant, so let's put the immediate implant in. I think we have to just draw the line.
Yeah, we do. There, the American Academy of Oral and Maxillofacial Surgeons did publish some guidelines, and you'll read those guidelines yourself. Don't necessarily trust exactly what I've said. I'm paraphrasing, and who knows? I've been prepping for this, and I didn't write everything down. But it did indicate that if the patient is going to suffer damage as a result of our not treating it right now, and that would be, for example, let's assume an asymptomatic endo abscess that might blow out the buccal plate, that it would be appropriate to see that patient now rather than wait until all of this is over. So there are ways, if we need to see emergency patients, we can, and you have to use your own judgment. Obviously, this is not to say open up your practice to full mouth extractions and put in upper and lower implants. That isn't what we're talking about here. But we do have to protect the public. If the public could get worse, or not could get worse, everybody can get worse. But if there's a real consideration that what we're letting go of could become an emergency. For example, we take a CT scan and we already see it that the abscess has gone through the lingual plate, but the patient is asymptomatic. Well, what's the right thing to do? And so we do have to look at that a little bit more carefully, and in my opinion, not just close our doors.
Yeah. One person asked about the use of ultrasonic instrumentation, which we're not going to be using. We're going to be reducing that spray. If it comes to how we're cleaning our instruments for after an emergency procedure, I know with our ultrasonic, things go in, the lid gets shut, and then the ultrasonic goes on, so we don't have that spray. So I would just say make sure you have that lid on. Some facilities do leave that lid open when they're running it. You do have to keep that shut. And if it's shut and staff is using their PPEs, it should be fine.
Well, that's the sterilization part of it, but what about the Cavitron? What about piezo in surgery?
Right.
That's, I think, the risk that we're entering into right now. Any comments on?
Yeah, I think the recommendation is just to try to reduce any aerosol spray as possible.
Yeah.
For our risk more than anybody else's.
Also, to answer the question on if a dentist has contracted the disease, it says a UF dental student contracted the disease abroad and treated patients in the clinic. 4 people have since been diagnosed positive. So that answers that question.
Okay. There are some questions as to whether my loan idea would work, and the answer is the question was not sure a loan will fly with labor law. For example, how would that work with time and a half? The answer is they would be paid their time and a half, and then they would, and the taxes would be taken out, and then with what the additional amount is, they would pay off the loan. So we're not trying to circumvent any labor laws or any tax laws or IRS laws or anything like that.
There's another question
just in case the
regarding
IRS
that.
is listening.
Right. Another question on that. Are you expecting repayment of more than what was loaned to them? No, we're not. We're not going to ask for.
We're not doing interest. No.
Right.
This is yeah. Right. One question, I think we are missing a big question. The CDC requires N95 fit-tested masks to treat a COVID-19 dental patient. Historically, we've treated all patients if they had hepatitis and HIV. The same standard is for COVID-19. We should have fit-tested N95 masks when we return to work. That will be a problem, and it will be a problem. Although I got to tell you, that problem may not be as great as we might think. Some of the the N95 masks are similar or exactly the same as what painters use or what construction workers use. And I heard that the law or the rule, the regulation has just been bypassed so that those masks that are being used in construction can now be used in healthcare. So that may very well give us a bigger supply. My understanding is that there's 5 masks used for construction for every 1 mask that's used in the medical setting. So that's what I heard. That's all I can tell you. That's what I heard.
Does anybody have an opinion on what mouth rinse is most effective for patients to rinse with? I've heard chlorhexidine, I've heard betadine, I've heard Vista.
I believe it's hydrogen peroxide is most effective.
And then there was somebody else who talked about, and it's not betadine, but it does have an iodine product within it, and I forget what the name is, and that's been tested against the virus. But again, I don't know enough about it to know whether that's really true or whether that's advertised.
Somebody else on here said hydrogen peroxide as well.
Yes.
Okay.
We've bought Peroxyl. We've got a few cases of Peroxyl, which is a hydrogen peroxide product. We're having our patients rinse with that. A few patients that we're treating. We used to routinely have everybody rinse with chlorhexidine for 30 to 60 seconds before we treated them, and now we're within the last week to the hydrogen peroxide product.
Okay.
Right. Good.
There's one question, this is for you, Danielle, I'm sure, regarding individually asking team members what their financial needs are and what their breaking point is. Can you offer language on how you phrase that question?
When I talk to them, and I've been doing that over the last 2 days, I just let them know that our staff is very important to us. We want to make sure everybody's taken care of. We don't have enough details or information to know how long this is going to last. We just know we have to close our doors to our patients and keep our staff safe. I said, I need to know what it is that you need. How much do you need? First of all, how much time can you take off? With your vacation time, with your personal situation, how much time can you take off? Because also keep in mind, a lot of our staff, their moms, their kids are out of school, or they're taking care of their elderly parents. So they're in situations where they really can't really be at work. So I need to find out what their situation is. Do you need to be at home, and what do you need for that? Okay, once you get past that point of how much time you can take off, what do you need to pay your bills? Do you need 20 hours, 15 hours, 30 hours? What do you need? And that's where the loan kind of came in, where they said, listen, I need 40 hours. I am paycheck to paycheck. Okay, well, I can get them in the office to work 25 hours and supplement with some of those loan hours. And because when we do get back up and running in 4 weeks, and we all know it's going to be on 4 weeks, we are going to have to work some Saturdays in order to take care of all this backlog of patients. So it's nice to have some staff taking this loan, because those are the staff that I need to work on Saturday to take care of some of these procedures and do some of these things that we're kind of putting on the side right now. So it's, let me help you now, you can help us later, let's get through this. And I've had a really good reaction with staff. There are some staff that do not want to work on Saturday, they cannot work on Saturdays, and they're in a financial situation where they can say, listen, I'm not working Saturdays, I don't need the loan, I'm okay, I'm doing good. But it also filters out those staff members that initially said, I need a paycheck. Now like, well, maybe I can go without a paycheck because Saturdays do not sound very good to me in the future. So, and I did get quite a bit of that actually. Like, Saturdays, yeah, I think I'm good for a few weeks. It's okay, I'm good. So it is a way to find out really what they need, because that's what we need to know. What do you really need right now?
Got a couple of comments. One is that the virus does affect young people. That's increasing a bit faster among the younger because they're not staying home as much as the older worn people, and I've heard that as well. I've been told that people applying for unemployment should not use their PTO, what's that, paid time off, as it will reduce their unemployment. Does anybody know the answer to that question? I don't know.
I don't know the answer.
No? Okay.
I don't know.
All right, and then we've got a former resident of Orlando, who's now in Chicago, says yes, there are cases of dentists and dental assistants. So thank you. Anyone have a long-term plan for the office if we have to close our offices for 3 months or more? I don't. You do? Danielle, you do?
No, I wasn't raising my hand. I was saying hi to my husband as he was talking.
Okay.
Sorry.
Yeah, I mean, for me, I don't think I can't imagine what that will be like. I think we're all going to come back very changed. I remember after 2008, some dentists in my study club cut down their practice quite a bit. Maybe they were 5 days a week. They went to 3 days a week. And after things picked up again, they said, you know what? I kind of like 3 days a week. I'm spending more time with my kids. I'm doing something else. I'm making enough money. I like my life better. So I don't know what that's going to be like, but I would just say, like in the beginning of this, if we're in for the long haul, you really have to buckle down and get rid of every last expenditure that you don't need, to ride it out.
Yeah.
And incidentally, I was at Home Depot yesterday. They're hiring. I saw the sign. I said, I could do that for a month or two. I always liked hardware. So who knows?
Yeah, I think when we come back, I think we're going to be busier than ever. And especially if you prepare your offices. I think this is an opportunity to get ready for that next future. About 7 years ago, my left lateral rectus, the muscle that controls the lateral movement of the eye, was paralyzed. And I had double vision for 3 months. So I practiced with an eye patch for 3 months. And I did no surgery because I had no depth perception. And I came back, and I tried to be cool during that whole period of time. I came back, and I was booked like 2 months in advance. And I stayed booked. It was just, I think we're going to come back. We're going to be booked very far in advance. And if we handle everything appropriately, I think we're going to have a great future. We're not, we're in better shape than most people. The corporation's not laying us off. We have control of our future and our destiny. This is a bump in the road for us. It's just a minor blip in the scheme of things. This is
we're fortunate compared to other industries. If you look at the restaurant industry or some of these industries that really have a razor thin profit margin, they really can't hang on for very long. Dentistry, fortunately, we have nice profit margins, especially in perio. And if you reduce your expenses enough, you should be able to weather this for quite a while. I agree with Mike.
Yeah. If you follow your accountant's advice, you should be able to weather this easily, but most people don't. Most people don't do all that.
Exactly
Yeah.
right. There's one comment that says journalists should be using rubber dams now. And of course, the Justin says, and thank you, Justin, the molecular iodine that I was thinking of has been shown to kill other COVID viruses. IO Technologies has mouth rinses that contain molecular iodine. That's what I've been using as a pre-procedural rinse. And so thank you, Justin, for that. Part of the unemployment requirements asks if you've used paid time off that you're entitled to, and it will factor into their unemployment assessment eligibility. So that's true. I'm just trying to see if there's any questions here. We just want to thank you very much. Thank you, Gennady. And is anyone afraid that patients won't want to spend money on treatment after this is over? So we won't be very productive when the practice resumes. The older population will have decreased savings. Who has a comment on that?
Well, I think it depends what it is and how badly they want it. If you have mostly a retired population, that may be an issue. But, we've been through this cycle so many times already when like you said, Lee, the other day, just remind them the stock market's where it was, when Trump started, and it's way up than where it was in 2008. And we all worked through and we're busy through all that time. So I think the key is you just have to provide good value for the patients and help them understand the value and help them understand the cost of doing nothing. Because when it's a good value, everybody does it. People don't want to spend their money when it's a bad value.
I think it's right. I think we're all going to have to sharpen, and I hate to use the word sales skills because it's really communication skills. There are things that happen in a good economy where it's kind of on automatic and that you expect it's going to happen, particularly we've been in a good economy for as long as this one has. Those of us who've had cycles, down cycles, remember what it was like during those other times. And maybe the larger procedures won't be done. Maybe people delay those. But listen, we're treating infectious disease. We're helping people. We're controlling their entire health through their mouths. And don't lose sight of that fact. If you need communication skills, I think, I've sent every one of my staff members out who communicate with patients on a regular basis for communications and sales training. It's very, very beneficial because it gets the staff member better in tune with the patient. And so it isn't you think of sales, high pressure sales. That's not what sales is at all. Sales is a communication cycle where you, in fact, communicate with the patient and you meet at a meeting point that fulfills the patient's desires, as long as within dental standard of care. That's okay. Whether we're talking about large cases and we might have to phase them out over a period of time, or whether we're talking about small cases and people want to see you just because of the reputation that you've acquired as a specialist. It's a good thing to do, and we are all in positions that where we are trained, we're highly trained, and we can, I hate to use the term, leverage that position in order to be able to get patients to visit us. So that can occur. By a show of hands, if you're interested in running another seminar like this next week, just let me know, so I'll be able to see whether in fact this was something was worthwhile. I appreciate all of the thank yous that we've gotten in the question and answer line. Any final comments? Any us should make?
Yeah, during this period of time now, these next month or two, I think it's going to be 2 months, is a time to practice communication, quote, sales skills. I agree with what you said. It's an educational process. So I would get the staff in and train them and work through all the various blockages that are there. During really good times, it's really hard to get a plumber. Okay, you can't get an electrician, you can't get a contractor, you can't get anybody to fix the squeaky door. And bad times, they're all there. Except those really good plumbers. They're busy when it's good, when it's bad. And I think for us, as long as you're doing a good job when things were good, you'll be busy when things are bad. And in 2008, I never really noticed the economy in our practice because we always maintain those really strong relationships with the patients. It's really treating the people that are members of our team, which I think is the most important part. And Danny Meyer, one of my role model, says our team are more important than our customers or patients. It's treating the staff. So this is an opportunity to really double down and be there for your team during this period of time, because without the team, we're not treating any patients. Very few.
Great parting message. Dr. Michael Sonick, Dr. David Scharf, Danyel Salmela, I appreciate your spending the time. I know that our viewers got a lot out of this, and thank you for giving us your thoughts, your wisdom, and your expertise.
Thanks, Lee.
And thank you. And for all of you who've joined us today, thank you for joining us on this webinar. Hope to see you soon.
Thank you.
Thank you.
Take care. Bye-bye.
Bye-bye.